Hello students, welcome back to the channel Physiology Redefined. Today I will discuss different topics, or rather start a different topics, that is the blood. Blood is such a topic, everybody knows about it, including the laymen. But in this class, I will explain the aspects which is very essential for the medical students. So please keep watching till the end and you will know some interesting facts regarding the topics, that is blood. So today I will start with the introductory part of the blood. So first let us see what is blood. Blood, you know that it is the red coloring agent, red colored fluid, which transports from one part of the body to the other part of the body and supplies different substances to the body cells. So as per the definition is concerned, it is defined as the fluid connective tissue that is responsible for transportation of different substances from one part of the body to the other parts of the body. And as per the volume is concerned, it is about 5 to 6 liter. 5 to 6 liter is the normal range of the blood volume. And as per the pH is concerned, so blood volume is 5 to 6 liter and pH, that is 7.4, normal range is 7.38 to 7.42, that means 7.4 plus minus 0.02, very narrow range of the pH of the blood. And as per the reaction is concerned, it is slightly alkaline. So in this video I will like to give some important aspects as per the composition of the blood or the blood components. So to discuss about the blood components, let us explain one experiment, that is in a Winthrop's tube or in the hematocrit tubes, Winthrop's tube or in the hematocrit tube, anticoagulant mixed blood is taken. Anticoagulant mixed blood is taken. So in this tube, anticoagulant mixed blood is taken, so that blood doesn't clot. Now this is centrifuged, this tube is centrifuged at the rate of 3000 rotation per minute for 30 minutes. The blood is centrifuged within the Winthrop's tube by the centrifugal machine at a rate of 30,000 rotation per minute for 30 minutes. So after 30 minutes, what we will see? We will see that at the entire tube has contained two compartments, grossly two compartments. In the bottom compartment of the tube, Winthrop's tube, the cellular components settle down. That means at the bottom, cells are settled down. Whatever cells are present in the blood, they will be settled down due to their gravitational effort. So they will be settled down. So this is around 45%, and this component is the cellular component of the blood. And in the clear supernatant, yellow color, straw yellow color, clear supernatant will be present in the upper part of the tube, which is known as the fluidic part, that is also known as the plasma. So this is around 55% plasma is there. So plasma as a straw colored supernatant will be there at the upper part of the tube, that is around 55%, and at the bottom of the tube cellular components will be settled down, and that is around 45%. Now within this 45% compartment, basically at the bottom part you see here the RBCs are settled. So RBCs are settled at the bottom-most part of the tube, and this is the part that is around, so this RBC is around 44%, and this is the part in between the plasma and the RBC. There is a Buffy layer, and this Buffy layer constitutes 1%, and this Buffy layer presents the WBCs, platelets, and also lupus erythromatous cells in case of lupus erythromatous. Also in this layer has got very clinical importance, because in case of some malignant disease or pre-malignant disease or lupus erythromatous, there is a increased premature cells like pro-metamyelocytes, like the megakaryocytes, and like the lupus erythromatous cells. So these cells will be increased, and as a result the thickness of the Buffy layer will be increased, amount of the Buffy layer will be increased. So this is the importance of having the Buffy layer, clinical importance of the Buffy layer, that constitutes mainly the WBCs, platelets, lupus erythromatous cells, and the premature WBCs. That are number of these are maximum in case of pre-malignant and the malignant diseases. So from this part experiment we can be able to know that blood is comprised of two main components. So blood is comprised of two major components. One is the blood cells. These are also known as the formed elements of the blood. And why these are known as formed elements? Because these has got a definite shape or definite form, and thereby these are known as formed elements, which includes RBCs or erythrocytes, WBC or white blood cells, and the platelets. So these are the different formed elements of the blood or cellular components of the blood. So regarding the formed elements or cellular elements of the blood, that I will discuss in the some other videos. So second component of the blood is known as the fluidic compartment. That is known as the plasma, and the amount of the plasma is, as I told earlier, 55%, and blood cells, this is around 45%. This is 45%. Now this plasma is again comprised of two components. One is the water, mainly is the water, that is 91 to 92% is the water, and remaining part of the plasma is solids, which is around 8 to 9% is the solids. So plasma has the two component, water mainly and the solids. Solid contains two types. First one is the inorganic component, and second one is the organic component. As per the inorganic component, this is again divided into two parts. One is the cations, another is the anions, positively charged particles and the negatively charged particles. Main cations includes sodium ion, calcium ion, magnesium ion, etc. And main anions are chloride ion, bicarbonate ion and the phosphate ion. So these are the main anions which are present as the inorganic substances. And this inorganic substances is around 1 to 2% and 7 to 8% is the organic substances. So now is about the organic substances. Organic substances, these are of again different categories. So first one I'll talk about the plasma proteins. So within the blood, some plasma proteins are there which has got varied functions, and these proteins are, they include the albumin, mainly the albumin. Second one is the globulin. Third one is the fibrinogen. And fourth one is the prothrombin. So four categories of the plasma proteins are there: albumin, globulin, fibrinogen, and in traces prothrombin. Albumin, this composition is maximum, which is around 55%, and this concentration of this one is around 3 to 5 gram percent. Globulin, this constitute 38%, and this normal range is concentration is around 2 to 3 gram percentage. Fibrinogen is around 7%, and this concentration of these things is around 150 to 300 milligram percent. Whereas prothrombin present in very traces, and its concentration is around 30 to 50 milligram percent. Now out of this, all of these plasma proteins has got very, very important role in our body systems, but out of these four, albumin and globulin has got very, very important clinical implications. Or importance. Generally what's happened, albumin is synthesized by the liver. It is synthesized mainly from the liver, and globulin is mainly synthesized from the reticuloendothelial systems. So if the normally what's happened, albumin and the globulin ratio, this has got a very important clinical complications, albumin globulin ratio, which is 1.7:1, and the normal range is 1.5 to 2.5:1. This is the normal range. However, its average one is 1.7:1. That is the normal albumin globulin ratio. Now this albumin globulin ratio is very, very important from the clinical point of view, from the diagnostic point of view, to know different type of disease by simply this albumin globulin ratio measurement. For examples, in case of liver failure, what's happened? Obviously, a liver cirrhosis, the albumin production will be low because albumin is mainly synthesized from liver. So liver damage, liver cirrhosis means albumin production is low. So in such a case, what's happened? Albumin globulin ratio will be low. So low albumin globulin ratio, this will happen in case of liver cirrhosis. Similarly, if the globulin production is maximum, is overproduction of globulin is there, like in case of autoimmune disease, this albumin globulin ratio will be also low. So in case of autoimmune disease, due to the overproductions of the globulin, the albumin ratio will be low. Similarly, in case of Nephrotic Syndrome, where the albumin selectively pass out of the body through the urine, Nephrotic Syndrome. In case of Nephrotic Syndrome, there is a selective passage of the albumin from the urine. In such a case, albumin globulin ratio will be decreased. On the other hand, the albumin globulin ratio will be increased in case of HIV infections, and also in case of some leukemia. In case of some leukemia or some other genetic disease, the albumin globulin ratio will be increased. So albumin globulin is very, very important from the clinical point of the view. So this is about the first category of the organic substances, that is known as the plasma protein. Second type of the organic substance is non-protein nitrogenous substances, NPN, or non-protein nitrogenous substances. So non-protein nitrogenous means proteins are nitrogenous substances because they have got the amino group. Now there are some substances in the blood which are not protein, but they have got the nitrogen in their molecules, in their constituents. So these are known as non-protein nitrogenous substances. Examples are urea, which is also known as blood urea nitrogen, that is BUN, uric acid, creatinine, xanthine, hypoxanthine. So these are the different substances which are known as non-protein nitrogenous substances because they are not protein but they have got the nitrogen in their constituents. Now these are also very important for the diagnostic purpose, to know to diagnose different type of disease. For examples, in case of kidney failure, what's happened? There is a increased concentrations of the BUN and increased concentrations of the creatine, creatinine, and also in some certain extent uric acid. So in case of kidney failure, these substances are increased. So by measuring these constituents, we can know about the status of the kidney. Similarly, in case of gout, that there is an increased concentrations of the uric acid. So if the uric acid concentration is more in the blood, we can know that there is a condition which is known as the gout. So these are the different type of non-protein nitrogenous substances, and the normal constituents of the non-protein nitrogenous substances is around 28 to 40 milligram percent. 28 to 40 milligram percent. So this is about the second category, non-protein nitrogenous substances. And now is the third component of the organic acid, which is known as non-Npn substances. These are known as non-Npn substances. So these are neither protein nor the nitrogenous substances, and thereby are known as non-Npn substances. So what are those non-Npn substances? For examples, glucose. And the concentration of the glucose is 70 to 100 milligram percent. This is in the fasting condition, once no food is taken, 70 to 100 mg percent. Second one is the cholesterols. Cholesterol is the second type of non-Npn substances, neither protein nor nitrogenous substances. Its concentration is around 150 to normal range 150 to 250 milligram percent. Third one is the triglycerides. Triglycerides, these are also the another type of non-Npn substances, which constituents is around 30 to 50 milligram percent. 30 to 50 milligram percent, that is the triglycerides. And another one is the phospholipids. So there are different types of substances these are the substances which are known as non-Npn substances, and these substances also has got very important clinical implications, clinical importance, because by knowing the concentration of these things, by measuring the concentrations of these substances in the blood, we can know about the status of the body. For example, if the glucose concentration is more, we will be able to know the person is suffering from diabetes mellitus. If the cholesterol level, triglycerides levels are more, we can be able to know that the person is undergoing some defects in the lipid metabolism. So this is all about the compositions of the blood. I hope this one is very clear to you. Composition of the blood is very clear to you. And if it is clear, don't forget to subscribe this channel. Thank you.